you. So good evening, everyone. I am Ms. Torres, one of the co-teachers for the class. And tonight, our special guest is Ben Levenson. So Ben Levenson is currently the Deputy Director of Justice is Global, a special project for People's Action. So Justice is Global's mission is to build a grassroots movement to win structural reforms and make the global economy more equitable and sustainable. He has been focusing since the beginning of the pandemic on a campaign for global cooperation to end the pandemic. Particularly the campaign that he's working on focuses on vaccine nationalism and the World Trade Organization and global self-financing at the International Monetary Fund, or IMF, if you're more familiar with that acronym. So please welcome our guest.
Awesome. Thank you so much, Ms. Torres. Appreciate everyone having me, and excited to share some stories and some of the basic building blocks of organizing. And I also really am excited to hear from you all about how some of these concepts relate to the stuff you're thinking about in class and in the issues and maybe the movements that you're participating in, perhaps outside of class. So yeah, my name is Ben Levenson, pronouns he and him. I am originally from the East Coast in Jersey, but live in Chicago, been in Chicago for about 5 years and have been, since I've been here, been organizing on a bunch of different campaigns, got my start in racial justice work around criminal justice reform, and feeling very excited about the Pretrial Fairness Act, which I was part of some original campaign work that I did when I was first getting involved in organizing, was part of efforts that led into that recent win, which I'll share more about later in my presentation. But I want to start off with a story, just a little bit about why I organize, why I'm here, why I'm here talking about structural inequality, and what we can do about it through social movement work. And for me, one of the most visceral ways that I connect to movement work is through a lot of fear I have about the safety of people that I love, my own safety and the safety of people that I love, because of the threat of anti-Semitism that has been rising in the US and across the world in recent years. And so my mom is a rabbi. She's a rabbi in a congregation in Burlington, Vermont. And one thing that has happened in the last 2 years, there have been a serious uptick in the amount of threats on her congregation, which just did not happen when I was growing up, did not happen 10 or 15 years ago. And just in this past fall, it was the Jewish high holidays, and people showed up at my mom's house, people were stalking her. Someone Zoom bombed the Yom Kippur services with Nazi threats in the chat. And for me, I share this because it's just clear to me, unless I organize, that the safety of people that I care about is in jeopardy. And so I want to be grounded in that, grounded in all of the different struggles that we bring into the room, and be clear about how we can address them and how I think organizing is one of the most effective ways to do so. So thanks all. So I want to start off with just a framing about 3 different approaches that we can think about social change generally or politics specifically. And these are 3 different types. So I'll categorize them as either the pragmatic approach, the idealistic approach, or a transformational approach. And so a pragmatic approach is working within the system as it is to make do, try to get the best, get what you can. An idealistic approach is trying to be really angry or passionate about all the things that are bad in the system. And a transformational approach would be one that sort of is the blend between these two. It's taking the moral outrage and trying to work within the system to change it to realize a strategic end. And so some examples of that. So here's an example of a pragmatic approach to social change. This is a healthcare lobbying group called the Partnership for America's Healthcare Future. They're one of the key groups that has been blocking Medicare for All. And they're center left. It's a lot of, they have a lot of power in the Democratic Party. And on the left is their ad, and then on the right are all of the different insurance companies that fund them. This, I would say, is a very pragmatic approach to politics. They're working within the system, lobbying decision makers to make to keep things the way that they are and maximize their own gain. An idealistic approach. This is a Banksy photograph. Keep your coins. I want your change. This is like a kind of moral outrage. They're like, maybe folks have been part of different protests that are very idealistic, but they're not aimed at changing anything. There's no specific demand or specific campaign that they're a part of. It's just expressing energy, expressing outrage. And there is definitely a place for that. But oftentimes this outrage doesn't lead to the kind of change that we might want to see in the world. And there's a transformational approach to change, which takes that moral outrage and directs it in a particular place to address a specific institution, a specific source of power, a specific piece of our structural inequality. And the photo here is from Minneapolis, and part of the uprisings around George Floyd's murder last summer. And as many of you know, that was just an opportunity of massive outpouring of social action, and it created a measurable shift in people's belief about criminal justice and about the police and about racism in this country. To be seen like how that plays out in our political system and whether or not this will lead to laws that change and like really saving people's lives from really messed up policies. But I think of this as like a strategic action directed in a particular direction. And I want to like, as another like grounding point is think about this example. And so I think my friend Anna, who connected me to this class, was one of the first people who shared with me this metaphor, which as I understand is like a foundational metaphor in public health. But the idea of like going upstream to find like the causes of different social problems or like determinants for health, and to see what are the social determinants. If you go further upstream, you see that it's not just that someone's not taking their medicine, but that there are like social factors that are leading to them like to not be able to show up to doctor's appointments and et cetera. So I find this to be like a really helpful concept. And I want to add like another element to this, which I think helps make sense of this in the context of organizing, is if we go like far enough upstream, I think we end up looking at this, which is how I see our society in the US, is that we live in a society where a very small number of people have a lot of power. And the vast majority of people are in a position where they don't have power, and this leads to all kinds of problems. So what happens is we have markets and business being the beneficiaries of a lot of the policies that our society and our governments are putting forth, and the things that people need that like will make them truly safe, make them healthy, make them live good and sustainable lives. Are always under attack. And so if you watch the videos that I sent along ahead of time, there's a bit more context for this. But I just want to like add this element to think about power as one of the key, and an imbalance of power in our society as one of the key factors that leads to negative outcomes in people's lives, or leads to us like not having the thriving communities that we all deserve. And so with that in mind, I want to, questions about the videos. We can send them out after, and great question. I'll share some more resources as well. And so I want to just like start. I'm hoping I'll do a little bit of talking and give space for reflection so we can also be a little bit more interactive. So I want to ask, like, how does this approach the like pragmatic, idealistic, transformational, and thinking about like power and the way that power might show up as a determinant of public health or any of the other social issues? How might that show up in your own thinking and in your own experience? So I want to do a reflection exercise. We take maybe 5 minutes or 10 minutes. We'll see how it goes. So how does this view of inequality and power relate to the issues that you care about? How is the power imbalance in our society contributing to structural inequality? And particularly, who benefits from that arrangement? So take 5 or 10 minutes. I want you to reflect, like think about that, and we'll come back and talk about it and try to process a little bit more, make sense of these concepts. Actually, maybe a good way to do this and keep this interactive is if folks are having thoughts and reactions to these questions, maybe you can start putting them in the chat, and we can hear some people's voices. Take yourselves off mute. So curious if you have reactions about how like the different approaches to politics can come up in your work. And also, how does this like view of structural inequality and power imbalance relate to the issues that you care about?
I'm sorry, so did you say that we should discuss in the chat?
Yeah, that would be.
I was going to say, you can put it in the chat and also unmute yourselves as well. But putting it in the chat will also enable other students to also be able to read your comments later, so that they can, some students are here or don't fully understand what you're saying. The chat might help them to understand, it's a point of access for them.
Okay, so I have it copy pasted, so I'll just put it there and also discuss it. So I was thinking about that middle one, the idealistic form, and how it relates to in terms of identifying a social problem, and how even though it doesn't identify a potential solution right now, it doesn't necessarily need to for it to still disrupt what's happening, if that's its goal. It'd be a strange expectation to place, just like for everyone to have to identify a solution.
Yeah, that's great, and I think it speaks to like thinking about artists and cultural work in movements or in like in political spaces. Like, yeah, there's a way, there's definitely a role for that, and there's actually also a role for a pragmatic approach to politics. And I think my case is not to say that everyone should be thinking about organization or politics transformationally, but that if you can get yourself to think about organizing or politics transformationally, then you have the potential to be an agent of change in a more powerful way. So like maybe a question I would ask back is like, could you imagine not just framing an issue, but framing an issue and having that be connected to organizations who are going to work on that issue and campaign to change it? But yeah, really appreciate your point. Yeah, Dorothy, do you want to say more about what you've written in the chat?
Hi, this is Dorothy speaking. So I was thinking, the question says, how does this view of inequality or power relate to an issue you care about? Being like a public health future medical professional, I care about historically oppressed groups not having access to healthcare. And well, how did that inequity manifest? And it manifested in not having political power to have policies that gave healthcare access and resources to those communities.
Yeah, that's spot on. And I think one thing that you're bringing up here, which is really helpful, and if we had more time, I would spend more time thinking about, but the ways that like this slide is also intensely racialized. Like the people who have a lot of power are, they use the power and do so in ways that are often racist, and people, it's not a representative group. So just like, I want to pull that out from what you're sharing, is the ways this can be acted on oppressed groups is really important. The power imbalance in our society. Seth, can I ask you to share a little bit more about what you've written?
Sure. Just coming from having some experience like working at rape crisis centers and different organizations, and kind of it goes to the downstream upstream thing as well, because I think a lot of resources are mobilized for victim services, which is super important, but I think a lot of times prevention is underfunded, and there aren't organizations, as many organizations like working towards changing those real like structures of patriarchy and toxic masculinity and some of the root causes of relationship violence. And then also, yeah, that pragmatic approach where it's okay, let's get together and create a task force or a community coalition with police and law enforcement and the hospital and mental health, and we'll try to do case reviews to see if we can get a little bit better at the system and let the system work a little bit better for survivors in the future. And I don't think that's completely without value, but I think the transformational approach is a little bit more appealing, but more difficult.
Yeah, and part of why there's a lot of messages in the chat and I can't read all of them, and I want to keep moving, but just to highlight here, not only is it racialized, it's very gendered, the way that inequality operates and the way that it affects people. And there's some really interesting research on the ways that inequality relates to sexual violence, and like more unequal societies have more sexual violence, and less, it's just like, it's both like part of how we address the problem is addressing this, and it just is like, it's structural. So just lifting that up from your comment, really appreciate it. So I want to keep moving on. If you have questions or like tensions, things that you want me to stop and ask, please keep putting that in the chat, but I'm going to keep going so we can get into some of the solutions to, or what I want to propose as what a transformational approach to address these problems might look like. And so with the transformational approach to organizing and social change, I think it is important that we engage with this concept of power. I think in my life, and also I imagine in many of your lives, power has a lot of connotations that are very negative. I've been around a lot of powerful people who have made me not feel great about myself or about my role in public or how much space I could take up. And I think especially for folks who've been marginalized or part of oppressed groups, power has connotations that are maybe not as, it can be a thing that's scary. And I think it's really important for us to think about wanting power, to think about power as a thing that is not good or bad. It is our ability to make change in the world. And that's how we can be transformational. And also to be clear about how we can get power. So we get power from, there's two, in foundational theory of this, there's two places. One is by organizing people, the other is by organizing money. Let me see if anyone had any questions in the chat. Okay, cool. And so the ability of everyday people to have impact on these large structural inequalities is determined about our ability to organize enough people and enough money to be able to have leverage in like major moments, decision points in like political decision making. And so, yeah, so question you might ask is, well, how do I get this? Well, okay, I'm interested in this idea. I want power. I want to make change. I want to have leverage in the system, but like, how do I do that? Well, actually, before I get there, just some examples actually of ways that like everyday people have like organized themselves into powerful groups that had the ability to make change way beyond the scale of their organizations. They had organized enough people to have enough leverage to change the whole system. And so this is from the civil rights movement. These are the lunch counter sit-ins, which were part of a whole movement moment. And as you know, the history is storied here. We're able to roll back a bunch of the most racist policies from the Jim Crow South. Another example is, this is a photo of the Flint sit-down strike in 1937, which was one of the key moments in labor movement history. This effectively like unionized like 30,000 people like overnight. They organized enough people and sat down inside their factory, and like people credit this as being one of the places of the birth of the middle class, because people after this were able to bargain collectively and bargain for good wages. And they were going up against like one of the most powerful companies in the world at the time, GM, and they organized enough people to have leverage in a very particular moment in a weak spot in the company. The fact that they could sit down in the company and stop the entire operation with just their bodies. And some examples very recently, and I was sharing this, I had been involved in some of this end money bond work like 5 years ago when I first got involved in organizing. And this law just passed. It just passed in the most recent, like a couple of weeks ago, which ended money bond in the state of Illinois, which is like in my view, one of the most racist things that exists in our system, is that people had to, without being convicted, were sitting in jail because they couldn't afford to pay for bond. And so this new law changes that. And that was after years of organizing, a huge coalition and a lot of people taking a lot of action to take advantage of this moment. And just an example from my own organization, this is a live stream that we did around global cooperation to end the pandemic. We were working on this campaign around vaccines at the World Trade Organization. One thing that we did a live stream in September of last year. And we somehow, like, it's still wild to me, but we did this live stream and got it up in the right places, and 70,000 people showed up. And now we're in a place that was like one of the initial actions in our campaign. And now we're in a place where there's a decision moment on March 2nd at the World Trade Organization. We're going to try to leverage some of that power to change the way vaccines are distributed and produced globally. This is just an example, one of the social media tweets, but I'll share more about that campaign if y'all are interested. So another reflection, a place for us to like think through this concept. This is where we could spend a lot more time on this, but I want to like think with y'all, like, how do you feel about power? I know this has a lot of connotations. Do you want power? And does it scare you? If it doesn't scare you, why not? And are there ways you might want to take action or could take action to build power to challenge structural inequality that you're not doing so already? So if you could put those in the chat, I want to hear some more voices from the crowd. Yeah, do you want to say more? Is that Magali, if I'm pronouncing your name right?
Yes, Magali. So I was just saying, I was directly thinking of Donald Trump, but I think there are many recent, like, other examples as well.
Mm-hmm. Yeah, totally. And does that affect how you think about the power that you like want? Like, does it affect your own relationship to power?
That's a good question. I feel like I don't necessarily need to control like something or have the power, as long as I'm like, I don't mind taking a more passive role.
Got it. Yeah, thanks. Well, yeah, that's a place to think about. Like, do you want to be in a transformational space? And if you do, it might be a place to like reflect a little bit more. And Natalia, great question. Like, how do you define it? I went over this very quickly. The way that the term that I'm using to define this is power is a very neutral concept. It's the ability to act. And I think that might be the definition from Webster's or something, but it's like the ability to act in the world and to make, all right, well, I'm gonna get it wrong. I forget what the Webster's definition is, but like people could act in good ways, people could act in bad ways, and it all determines like how they're getting their power and what their values are. Wayne, do you want to share a little bit more? That you don't want power, but you appreciate. Oh, so many comments. This is great, but I'm having trouble getting to all of them. Wayne, do you want to share more of what you wrote?
Can you hear me now?
Yes.
Okay. Sorry, I was just eating dinner and hadn't turned my microphone on yet. Yeah, I was just saying that, like, I don't personally want power. I can't imagine really being like the owner of a company or actually, I've had a hard time imagining myself owning like a house ever until like the past couple of years. But and that's even like owning property is a form of power, right? So I guess to that extent, someday I'd like to own a house or something, so I don't have to like live under other people's power, you know, paying rent. But I don't see myself ever being like a politician or owning a big company. But like I mentioned, I appreciate the need for a collective power in order to like address systemic injustices, which I think is what we're talking about here. Yeah.
Yeah, sweet. And I think maybe a thing to think about there that I would encourage you and maybe everyone to think about is like for us to have collective power, that means that each of us also has to have power to be part of formations that have power and are acting collectively. Means that we ourselves need to have power. That might look different than like owning a house or being the CEO of a company, but like, can you lead a meeting and bring people to a meeting? That's a kind of power that can be really effective.
I guess I have one more thought in response to that, if that's okay. Maybe what we're talking about when we say that we don't want power, like, because I noticed a bunch of other people saying similar things, is we don't want disproportionate power. We want like proportionate to other people around us, rather than, you know, yeah. So like you're saying, it's important to recognize that you have power to like contribute to change, but not to be like the sole person responsible for initiating change, I guess.
Yeah, that's great. And that's a concept I often talk about in my organization, to have power with and not power over. But for us to have power with, we also need to be grounded in our own power individually. So thanks, Warren. Shannon, I would love to hear from you. You said power is a bit scary because it might corrupt people. Could you say more about that?
Well, I just think that in terms of like politicians, I think of power, I think oftentimes isn't the right word, I guess, but I think in some cases people go into policy or politics to do good. But I think sometimes with power comes a lot of money and endorsements, and that sometimes I think shifts people's view on priorities and stuff. So I think when I look at power and kind of how power and money changes people, it does kind of scare me a bit, similar to what other people have said in the chat, that a lot of people might want to use power for good, but then it might fall into the wrong people's hands, and you never know people's true intentions.
Yeah, that's great, Shannon. I appreciate that. And I think that there's something like really both strategic and also maybe there's a thing to reflect on more here. There's something strategic is if you go back to this, like basic diagram, if the power that you have, the like base that you have that is making up your power isn't like, if you're getting money from pharmaceutical companies, you're never going to go after the pharmaceutical companies. If you're getting money from big developers, then it's going to be hard for you to be for affordable housing. And so there's a thing here where you're saying like it can corrupt you if you're taking money or building power with the wrong people. And I think perhaps like I think the thing that I see that happens a lot is people think about that and then also think that like power just generally is corrupting. Like I can't be in a place where I'm acting powerfully in public because that's bad. It's morally corrupt and I will end up being a bad person. And I think if you go in with a clear sense of your values and a clear sense of what you want, and you're building power with the right people and in the right kinds of ways, there's a way to do it that's not corrupting. That's my contention. And I wonder if you might reflect on that and think more like, well, could I do that? Could I think about building power with my classmates or with my community to push back against the worst parts of our systemic inequality?
Can I reply to that or respond to
Please.
that?
Yeah, please.
Yeah, I could totally agree with you. I think I was thinking more, like I understand that we as people have collective power and we as people have power individually as well. But I think I kind of thought about it on like a bigger point of view, kind of like government systems and stuff like that and policies. So that's kind of where I was coming at it from. Sure. But I agree as well. Like I think as people, we can, if we stick to our values and like create collective power, we are able to make change and push back against, I guess, the government. I don't know a better word, sorry, but yeah.
Yeah, no, that's great. I think that's a really important point, and especially if the government, I think it operates in a similar way, just at a much bigger scale. So there's a lot more interest in a lot of very powerful people who are jockeying to have influence over decisions. So it can be a trap in a lot of ways. But it's, I think, the same basic formula, like where a politician gets their money from is like a huge part of what kinds of decisions they make. And so when I'm thinking about a campaign that I'm running, that's often the first place that I go look to think about like how to find allies. And how to think about who the targets might be.
I can actually give you a really interesting complex example. So I was part of a group of disability rights activists, mostly in higher ed back home. And we used to go do a lot of these walks or runs or, to bring awareness to the fact that, well, yeah, this is an issue, but also disabled people have this issue too, such as like breast cancer or other kinds of issues and how disabling these other things can be, and to show you have a support. If you have cancer and you're in remission, you have support, or even if you're not, you have the support, and we are an organization that will help support you, find resources. And one campaign we were doing was funded by Autism Speaks, which is very controversial in many ways. You guys can look it up. And so there was one person who was in our organization who was part of another who was, very much either was autistic and was very much against Autism Speaks. And, he was the only person, because at the time I didn't know anything about the organization, but through, him speaking about it, I learned more about like how complex the issues are and the issues autistic people have with Autism Speaks. But a lot of people were just like, oh, but they're a disability organization. It's like, yeah, headed by disabled people. No disabled people are on the board or in decision making. No disabled people have power. And as such, they are speaking for disabled people. And he really drew that connection to me because most orgs I was in are run, the people who make the decisions are those people who have those identities. Yep. And so he pointed out that you really do have to look, what kind of power are we speaking about? Who has power over whom? And that was just a really great kind of aha moment for me to be more aware and coherent of who I'm working with, who they're working for, and the power structures that happen.
Yeah, totally. And I think if you, I think, again, going back to this concept of power over versus power with, And I think the transformational approach to organizing and social change is when we think about power with, that's where we're most accountable to the people who we're fighting for and fighting with ourselves, you know, the stuff that most directly impacts our own lives. Those are the situations when we can be in a transformational place. Seems like there's a lot of comments in the chat. I really appreciate it. I want to move on to another comment, another element of power and how we think about it in organizing people. So one other, just like one of the foundational concepts of organizing is to think about how we organize people. And we organize people based on shared self-interest. So this concept also has like really negative connotations. Self-interest can seem like selfishness. I think of self-interest as the stuff that like gets me out of bed every day. It's my motivations, my deepest dreams and ambitions, what I want to see in the world. And it's not about like myself. This is again in this concept of power with. And let me just see in the chat. And so I think of self-interest as these things. These are the things that motivate me to act in my public life, in my public work, in my organizing, my experiences that teach me about how I understand the world, my values, the fears I have about what's happening to my family around anti-Semitism, dreams I have for us being able to live in a world where we like everybody can thrive and have what they need. Yeah, so these are all these things like inform how I engage and what sorts of causes I take part in, what sorts of organizations I donate money to. I imagine what organizations I want to spend time supporting. I imagine many of you have other organizations that you're supporting. This came up in the chat a bunch about different things that people care about and that they're working on. In organizing, it's really important, at least in this brand of organizing, to think about self-interest as what connects us to each other. It's not about like about mutual love or affection. That can happen, but it's more about like, do we have a shared vision? Are we going in the same direction? And can we work together on that direction to like try to take action to address the systemic problem? And so I think about it like this. If we look at our power map, it's our organized people and money are organized around shared self-interest. The organized money piece is also just organized people. It's organized people who have money or people who have a small amount of money, but a lot of them. So it's all people at the bottom of this like ladder. And if you think about it and you look about it in this way, then it's a base. It's a base of support that you can use to take action in the world, to have leverage over decision makers, to have leverage in the political process. And a question that I have here, which is a mini reflection question, is there's like another way that people often approach organizing, which is more like movement work or social change work, nonprofit work of different kinds, that can be very much based on like urgency or based on guilt or based on this campaign is we have to win right now. It's like really important, make 6 calls, donate $1 billion to, donate $3, donate $3, donate $3. And it's on a kind of urgency and I think around a lot of guilt. So I'm curious if like folks have had that experience where they, like someone was trying to get them involved in a particular cause, a particular organization, and it just didn't really feel like it was about you or didn't really feel like it was in your interest to be involved in that work. You can either like drop in the chat if you've had that experience or just like you can do a reaction in the Zoom. But has anybody had that experience where like you've had someone's trying to organize you and it just didn't feel like it was about you? And you can share an example in the chat if you have one. Yep. So oftentimes this happens, it's not about you because they don't know what they're about either. So I want you to come to this meeting, but I can't actually tell you what we're trying to do in this meeting. Yep, politicians asking for money for sure. Yep. Yeah, and so for me, I mean, lots more, that's great. Yeah, the ice bucket challenge. Okay, cool. Yeah, so these are often about the other person. It's about what they want to have happen in the world, but not about you or what you're trying to move, you're trying to build, what issues that you care about. And so I think that self-interest can get this like bad rap because it can be sort of associated with like people being very selfish, as I said earlier. But if we think about it transformationally, this is also a place where we can have power with people who share our interests and want to take action to have leverage in the political process. So that brings my next reflection question. And this is just asking you to reflect on what you think your self-interest is. So some questions that might help you think through that. Like what are the things that get you up in the morning? What are the things that bring you energy? What kind of impact do you want to have in your life? And like, imagine you're like at the end of your careers and you finished school and you're thinking about what kind of change you want to have. What do you want your legacy to be at the end of that? So yeah, if you write in the chat what you think your self-interest is, and I'd love to hear from a couple of people. Mm-hmm. 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 Yeah, and Dorothy, I think that's great. And like self-interest can also be very, very much about your immediate sphere. It can be stuff in your life. It could also be very big. It could be about ending intergenerational poverty, like in the whole country, addressing that at a systemic level. Mm-hmm. Yeah, making education more accessible. Okay, yeah, Jessica, that's a great one. Like thinking about praxis and pedagogy and nursing. Okay, the next question I want to ask, and it's not on the slides here, but just as a question for y'all to think about also, do you know other people that share those self-interests? People in your lives, in your networks, in your communities that share your self-interest? And can you imagine engaging them around those issues? Would love to think about that, engaging them on their shared self-interest with you. Sweet. Awesome. Well, so I think that this is just like fundamental. These are like some of the building blocks here. But one of the key pieces where you can go from here is you imagine what other people care about, what you care about, and you can figure out how to build stuff together. Stuff that is like durable, that is long lasting, that is powerful and can take action collectively. It's not just like, can you do one thing right now? Can you give money to this thing because it's urgent? It's like we have a long-term vision. We want to see this problem affected. We want to be the kind of force that can have leverage, like the sit-down strike, like the civil rights movement organizers, like the Pretrial Fairness Act and the Coalition to End Money Bond. Can you imagine yourself in that place that is transformational? And when you can imagine yourself at that place, that's when you begin to start thinking about organizing transformationally. And so I want to make space for some more questions about like some of the systemic analysis. This is a very brief intro. I kind of blew through power and self-interest. The next thing we would do would be talking about, there are other skills beyond this, but these are the foundational building blocks. And like the next steps are thinking about how to build organizations into movements, how to run campaigns. And I stopped because the thing I think is most important and the thing I want to really make space for is figuring out how everyone in this room can see their work as part of that broader structural inequality, and the way that power imbalance is just like a huge part of that. And when we don't think about power, elites and people who do have power benefit because they're in a position to be unchallenged in the power that they do have. So I know there were a bunch of questions about, okay, great. Yeah, questions about working with organizations that aren't on the same page. I know there are also a bunch of questions about neoliberalism, which I'm happy to jump into more from these videos or some of the readings that we had. Yeah, tips for working with organizations that aren't on the same page as you are, and is it better to start something new, is a really good question. And Ms. Torres, when we were talking in the beginning, was talking about there just being so many different organizations and that being kind of a problem. But there's like a lot of fragmentation. There can be lots of people wanting to start new things. And so, I mean, I think the thing that I often, it depends on what the problem is. So maybe Alexis, if you would want to share more about what the problem is, the place that I would start asking is, what is the organization's self-interest? What is the organization trying to move? And is that aligned with mine? But if there's a more specific question you have, I'd be happy to think through that too.
Yeah, I don't have a specific question, but I'm kind of thinking about organizations in particular that like to maybe present that they are radical, but in realistic, no, when you take a look at it, they're really just functioning as part of the same neoliberal system. So how do you approach those organizations who kind of on the face value have the same self-interest, but aren't really interested in changing their structure to kind of empower people to work together in that power width that you were talking about?
Yeah, that's really great. And you know, this is close to my heart as a question because I have recently just joined the board of an organization that does this. I've been like, there's a lot of potential here and you guys aren't doing the thing that you say that you're doing. Like, can I help you? Can I be a force from within to agitate and push to be more transformational in its like this organization's approach? And it's really hard to do. It's just as a point, like it's very hard to be pushing organizations to change like structurally how they operate because of the way that they have power, right? So like if they're getting money from a particular group of people, even if they want to message in a particular way, they're accountable to their donors because they won't be able to raise the money in the future. So I think more than looking at what someone says about what they do, I would look at what they do, which sounds like what you're doing. And then like, it might just be that these organizations are not actually moving anything or not going to be in a place to move anything in a progressive or transformational direction. And like the like, I guess the point here that I'm making is you can have power within organizations. You build power within them. You get on their boards and you try to move the directors and you could even move the donors. And that's just a very long game. And so if you feel like really invested in a particular project or you think there's a lot of power there, then the project is to organize internally to try to change that institution. And I think there's a lot of potential there. It's a long game.
Yeah, I think also looking at who's hired and what their ideas and ideals are is really important because when we're talking about the other groups, they don't like, who do you center in your work and are those people in charge, right? So if you're saying, oh, we center queer people or Black people or disabled people, okay, are those people leading the charge or are you just saying that because then you're speaking for them, right? And you're not building power with them, you're building power over them. So I think that's also important to think about. Are they, you know, yeah.
Yep. And I think that this often comes up if folks have thought about this concept of like tokenizing. I think that part of how I think about that concept is sometimes even we can center a particular community or particular issue, particular voices, but even if we center those communities, I think, Ms. Torres, to your comment earlier, are those people the ones making the decisions? And if not, what's the plan to get people to have the power within those organizations to make those decisions? So I think it's as much about like the messaging as the decision making, if not more so the decision making, and who are in those seats of power, and like, is it a power with situation? Yeah, other questions, comments, reactions, tensions, something you're sitting with that like just doesn't feel like you're concerned? I thought someone might ask this question, and I love it. Can we really transform the really big systemic things like neoliberalism? It's a great question. And this would require like a deeper political conversation about like what neoliberalism is and how it functions, and how we can think about our moments of influence. But I can say, at least from my perspective, and folks disagree on this for sure, it's a controversial point, but that neoliberalism is a particular system and at a particular historic moment, and that right now it's in crisis. So like, basically the neoliberal, oh, and I should say what neoliberalism is first, if you didn't get a chance to watch the videos. And I'll give opportunities. We have a reading group that we run to dig into some of the more political discussions. So if folks are interested in learning more, there are places to get some of this deeper engagement. But the way I think about neoliberalism is it's a system that's like really just based on markets and business and trying to make money for a select few. And it's like an expression of the way that capitalism functions to generate profits and reproduce itself. And it's a particular system. It's only been operating for about the last 40 years, since like about Ronald Reagan. And my organization's position, and many folks in the progressive world see neoliberalism in a moment of crisis. We like COVID as an example, like we can't even like address this crisis, so much so that hundreds of thousands of people die, is like an example of like our government not being able to function and governments around the world not being able to function. And there are like other signs of crisis, just like the economy is not functioning in a way that people not being able to get the basic things they need to survive is an example of the crisis that we're in, and climate being another. So there's a moment of crisis, which is a weak spot for the system. And if we can figure out how to like organize enough power to address it, we can transform it and make it more equitable. And so, yeah, that's a very theoretical point, forgive me, but I would love to talk more about it. I really geek out on this stuff and would love to share more. Okay, Megan's question, can you speak more to the culture of villainization of individuals who tap into collective power? Can you say more about your question?
I don't want to out myself as a former CPS teacher, but is there any way that we can kind of overcome that individualization, those feelings that I think are put on teachers because they're using collective power, whether it be for bargaining for better pay or safety?
I see. Yeah. So this is like a tax from the other side. This is a tax from business or from the mayor or whomever. This is one of the pitfalls, I think, or like, I don't know if it's pitfall. It's like one of the occupational hazards of being in the business of trying to build collective power, is that when you have power, people want it, right? So they don't want you to change the way that bargaining operates, or ask for better wages or better working conditions or better conditions for your students, because it makes their lives harder and requires them to make decisions that make other people unhappy. So oftentimes what happens is that when you have power, it means that other people will will, will attack you. And this is just one example of that. And so I think the answer is one, like, it's a sign of your power if people are villainizing you. It means that they are scared of you. And like, if you want to make their threats not credible, is you have to have more power than them. And so the solution here is to figure out how to build enough power in a sustained way to be able to withstand the attacks. And that would be at least my off the cuff answer to that question. Does that respond to what you're saying, Megan?
Yeah, thank you for your input. Interesting.
Sweet. Particularly visible in the global South, where governments, yeah, Zoe, this is a question that is very close to my heart. I've been thinking a lot about like global inequality in the ways that like the global South just like isn't even part of people's like consciousness in a lot of political discourse. One of our campaign right now is about vaccine access globally. And if you guys have heard this, it just came out like maybe last week, but like it's projected that people in the global South won't get vaccines or won't be fully immunized until 2024. And that's because the US and other rich countries have hoarded the vaccines and are hoarding patents and intellectual property to make the vaccines, which is just like utterly inhumane and actually very stupid, because it means the pandemic will keep going on and on and on. So forgive me for my rant. Zoe, do you want to say more about, is there a question here, or more this is just a comment about how this plays out globally?
Yeah, sorry. It was just kind of a comment of like my understanding from being a grad student in anthropology. Mm-hmm. So I was sort of curious if that conversation about like this side of neoliberalism, where there's less and less reliance on government to do sort of anything social, I guess, and then an increasing reliance on anyone who steps into that void, if that is discussed in like organizing or in public health, or if it's more just this view of like neoliberalism equals capitalism, which is another discourse that I'm aware of.
Yeah, I think I understand your question, which is like, are people thinking about the way that NGOs are showing up and how that relates to the global South, and the way that neoliberalism is related to development? Is that right?
Yeah, kind of, and how it's like a larger, I guess, also like socio-political economic philosophy that maybe like certainly is like a capitalist outlook, but involves also the role of government in people's lives and like in providing services or not. And obviously then that's then linked into certain capitalist beliefs, but obviously like not all of them, because you have like Elizabeth Warren, who identifies as capitalist, but clearly also believes in like strong government and like a big federal government that is involved in a lot of assistance.
Yeah, well, so there's a lot here, and we could have a whole like seminar on this. I'd love to talk more if you're curious. I think the like basic thoughts that I have is just like, this is one of my organization's like reason to exist, is that we're really concerned that like people don't make the connection between global and local, between like NGO world development economics and systemic problems like neoliberalism, and the way that neoliberalism is in crisis. And so like you see this around COVID, is just like the people who are like in lots of positions of power just utterly have no idea what to do. And so we have these like vaccine patents that are like a key feature of the neoliberal system that are making it impossible to even just like continue to exist. And so like we're really concerned about that and trying to figure out how to connect the dots for people by organizing the power. People in the global South have known this for decades, and they've been organizing around it forever, but folks in the US don't, and there's not enough power here to advocate. Because we're really bought into like American exceptionalism and American, like we're special.
Right.
And so
That's all.
Please.
Just like in India, I hear the term like NGOization a lot, and I don't hear it here very often. So
yep.
I think in certain circles here, yes, but like much less. Yeah.
And so like, and if you're here in the US and you care about global poverty, it becomes like something that is very NGOified, but like there's not any way to think about challenging that or having a different model that's structurally different, where like people actually have the things that they need in other countries, and they don't need Western governments to provide sort of like strings attached funding. So yeah, I think it's an all over problem, and trying to figure out how to address it is a doozy.
Yeah, and it's like, it's here too. I think in many ways it's just like I saw someone tweet about, this is the last thing I'll say because I know you need to move on, but like about those like electric scooters that have been rolled out in big cities being super neoliberal, and I was like, what? And then I thought about it, and I realized like it's a private company that is stepping in, like they declare themselves as stepping in to like fill the last mile, quote unquote, gap of people's public transportation, and maybe especially in areas where theoretically, where like there's less quality public transportation, which are then also going to be like areas where more marginalized people live, because that's the pattern in our society. And yet it's like, right, it's not the government stepping in to do that. It's a private company that is at this point existing on like, I don't know, like some people's investments, because I know they're losing money, but yeah.
Yeah, so really good point. And just like another feature of the neoliberal system, as I see it, is that it's about like fighting government, small government, not having public goods, public services. Like we can't have nice things. It's only nice things that come from companies, and those nice things are contingent. They're like, we have to pay for them exorbitantly, and you know, it's like these are public goods that we actually fund. And so yeah, just appreciate that element, bringing that in. Yeah, okay, question about local politics and the broader global politics. To what extent should we focus on more local needs versus regional, national, global issues? Yeah, this is a really good question. I think a question that I would want to put back to each of you as you think about like the ways you want to approach your own political lives and your own political like social change work in whatever fashion that exists, is like, what's the scope that you want to think about? So there's like a question that's like personally about your own organizing. To what extent should you be thinking local? Should you be thinking regional, national, global? I think that that's a question that like, there's really good work that can be done on a very, very local level in a particular neighborhood, for example. Folks can organize things that can be really impactful for people in their neighborhoods. And similarly, like at the city or county level or the state level, like this Pretrial Fairness Act, or like work that was done at the county jail to try to reduce incarceration there. Like those are examples, those are really necessary and very important, important efforts. And I think it's really also important to have the sense that we live in a global system, that we're connected across borders with people based on all kinds of systems. And like one way that we can think about that is that climate, as an example, like we live in a climate that everyone shares. So like the borders that we live in, or the like national confines, like they're not as meaningful to addressing that global problem. And so what I like to say is, in the things that we do, it's like to be global and local in our politics. I think Shannon was mentioning this about a term that can describe that. And my like you know, position, what I hope folks would gain from this conversation, is that even if you don't work on the global stuff, you see the work that you do as part of a global system. If you're looking upstream to think about the power imbalances or the determinants of health, or whatever the issue you're working on, to see those not as like within a particular city, but within a whole global context. And we can make impact both locally and globally on that system, but have to be clear about the borders of it. Yeah, and Brian, really appreciate your point here. Like really important, you can have really measurable impact in your lives. Like you can see a change, you can win a particular policy at the city level that could change millions of people's lives. And so, yeah, just 100%. Any other questions, thoughts? And it's something I'm really curious about is if people have tensions. Does something come up here that you were like, ooh, that like sits with me weird because I haven't thought about organizing this way, or even I'm a little bit uncomfortable about that. Would love to make space for stuff like that.
Can I ask a question?
Please.
You know, when you were talking earlier about, how do we bring our discretion to the organizations? And sometimes you're sitting, say you join a board or something, and how it's good for us to ask or to say, I don't actually see you doing the things that you care about or that you say that you're about. When you said that, I realized that I think that's true for me. Like I could say it to myself, Lori, I don't actually see you acting really in the things that you care about. And I don't want to turn this into a personal thing, but I don't know, for some reason that all of a sudden seemed kind of profound.
Yeah, well, I think that, yeah, and it seems like there's some resonance from folks in the audience. And a question that I would have for you is why not? Like what's getting in the way? And we can talk more after or offline, but just like I think that's true for a lot of people, and it seems like there's resonance. And the question I would ask is why not? And oftentimes what comes up in my work is that like this is the stuff where I think this is where the magic is, where you get to figure out what are the things that hold us back from being powerful, that hold us back from taking action in the way that we want or acting on our values. And oftentimes the answer is that there's some sort of fear or some message about that our society has given us that we shouldn't be acting in the way that we want. It's too risky, or I shouldn't put myself out there. I'm not doing enough. I'm not good enough. I can't be the voice. And so if you have an answer to that question, I would be curious if you'd be comfortable sharing, and would pose that to everybody. Like, are there ways you could be more active? And if not, what's holding you back? So yeah, Lori, do you have thoughts? Would you be comfortable sharing?
I do. Just so as a student at UIC, I think it feels important to me in every single assignment to bring up the kind of things that we're all talking about and caring about. And yet there's no there isn't like interaction back and forth in these classes. It's a asynchronous setup, and I just have this kind of blind hope, and maybe not 100% faith, that it makes a difference. But I don't know. I mean, this is helping me realize that I need to remind myself that this is one thing that I can do right now, and I believe in it. And so what if I don't actually see any kind of response or connection? That maybe I just get to assume it's out there.
Yeah, maybe a thing that I would offer is that perhaps like a way to think about this is that like it's really hard to do the kind of work that I think many of us on this call, I know I'll speak for myself, just like the things that I care about it's hard because the world is in such a bad place. And so like we can't do it alone. And so I think this gets to this concept of power with. It's like finding collective people that share the self-interest and figuring out ways that you can work together, whether it's an organization or another person who's like co-conspirator in a project. And there's a lot in our world that tells us that we have to be alone and we have to think about ourselves as individuals. And if we can start like challenging that and thinking about power with, it's an opportunity to confront that. And so I'm seeing a lot in the chat about this, and like a lot of the things that are holding people back. So Lori, I think you're not alone, that there are things that are holding people back. And I think there's something beautiful here about just like seeing this in the chat, is that like people being real about what's holding them back is actually the first step in towards like building the kind of collective power that can change it. And I think this also goes back to the comment that Alexis asked, Ms. Grant asked about organizations. Like we can also do this with organizations to say like, hey, you're not doing the thing. why not? Like, is it because the structure is wrong? Is it because the people are wrong? Is the power not organized in the right way? Just like, I think that is the work, and I encourage everyone to do it, and really excited that it seems like folks are in a place to go there. I think I have space for one more question. I'd love to dig in more with anyone who wants to talk offline, but are there any other questions before we close out? And I want to just share some opportunities for further learning if you're interested.
I actually had one that I think kind of relates to some of the tensions or some of the issues we've been talking about with NGOs and other things. So how do you feel about the organization of, or people organizing themselves around NGOs versus kind of just organizing, like just organizations that aren't 501c3s or anything like that? Because most of and I've been a part of 501c3s and also I'm a part of a lot of groups that aren't 501c3s. So how do you feel about the ways in which they both approach these kinds of issues around power, self-interest, and impacting and things like that?
Yeah, that is such a good question. And there's probably a longer conversation we can have. But I think that there's a space for it. And the question is like, what's the goal? Like, what sort of change do you want to make? And for some people, the answer, like my organization is a 501c3, and we're figuring out how to organize people and not be like part of like the nonprofit industrial complex, like having a vision for our own organizing and not let the money dictate how we govern and how we direct our programs. It's hard to do. I don't know if I'm doing it right, but I'm doing my best to work within that system. And that there are advantages to that system. Like we can get money that other people can't. And so it creates some sort of space for us that not having the legal status wouldn't allow us to. And there are things that you could do without the legal status that would be also like equally transformational. You can be much more nimble as like not as an incorporated organization. You can just like do stuff. You can show up. A rapid response action needs to happen. Figure out how to get people to stop the deportation. And groups do that, and communities do that a lot. So I think it depends on the situation, and would encourage you to like think really intentionally about what your goals are for how to address that problem. Okay, so I think I'm supposed to end. So I want to just share two more things that you might want to be interested in, and a meme that I love. My organization leads just like a discussion group. And here's the graphic, which I made, which I really like, which is what the heck is neoliberalism and racial capitalism and structural oppression. If you're interested in like digging into more of these concepts, we're having it, and it's starting on Saturday. So I'll put that in the chat. Maybe your instructors can share. But this is our first reading group of the year. And then we also have on this campaign around global health, we have a base, a group of people that are organizing themselves who are like public health people and global health people. So folks, we have some doctors and some public health practitioners, some folks who are working in the NGO world who are like trying to figure out how to be transformational. And if anyone's interested in being part of that or getting engaged in any of our campaign work, they're having a meeting coming up. And just would encourage y'all to show up or message me. I would love to connect you to organizing work that I think really can be transformational. And here's my last slide, which I love, is a meme that one of our volunteers made, and it makes me laugh every time I see it. I think that's it for me. I really appreciate everyone making space for me today.
Thank you so much for coming and answering so many of our questions. Folks, feel free to check out Justice is Global and the resources that Ben shared. And we're going to take a little break now. So for students who are registered for the course, we'll come back in about 10 minutes to talk about the readings and our discussion points. Otherwise, thank you folks for joining us.
I'll see you in about 10 minutes, y'all.
So many great questions. All right, folks. Does anyone want to share any like first reactions from the talk or readings?
I thought it was surprisingly optimistic for such a big concept, like thinking globally, thinking about economic systems like neoliberalism. I thought it would be a little bit more like, wow, that's really difficult. It's going to take forever. That's some of what I shared on the discussion board, but I'm feeling, yeah, more optimistic.
I think this is one of those topics that you could like honestly talk about all day and just have a whole seminar on just neoliberalism and how it affects health systems and stuff like that. So I really liked how Ben was able to, I guess like he was able to like hone in on questions stuff like that, but also was able to relate back to kind of his whole entire talk about power and stuff like that, which I really appreciated. But it's kind of one of those things that I think I have to go back and rewatch the big presentation to kind of grasp everything that was being said, because it is such a intense is the right word, I'm sorry, but like it's such a big topic, I guess.
I really like how he challenged us to think of our own conceptions of what power looks like. He didn't like just give us abstract concepts like this is what a power would look like in a corporate setting, this is what it would look like in like an organizational setting, but he really like pushed us to think about how we have interacted with power in our own lives, like day-to-day lives, and I enjoyed it. I enjoyed that part of it.
Yeah, this week was really good progression from last week to this week when we were talking about power more abstractly last week, and this week's is kind of a little more tangible.
I also just liked the delineation of the different like frameworks, like pragmatic, idealistic, and transformative. And I think it's helpful to like continually think back to that as we think about whatever kind of jobs or specific public health interventions or whatever we're going to be doing, and like always at least being honest with ourselves about where we are in that framework.
Yeah, I noticed there were a couple of questions and comments on the discussion board about the practical aspect of what it looks like to you know, push for this global approach and changing the whole underlying system. Did this talk like impact your viewpoint on that? How do you feel about the practical aspects of power redistribution?
Well, I think one of the things that we have as Americans, and as particularly for those of us on this chat as highly educated Americans, we've got access to more power than most people in the world, right? Even if we're less empowered than, you know, some people in the US, we certainly have access to all sorts of structures and resources that can push that. So for myself, I sort of feel like it's my obligation, right, to step out into whatever arenas I can where yeah, right, and to for want of a better word, to capitalize on on, you know, but on the power that, you know, that we do have as, you know, relatively advantaged people in, you know, what is, you know, sometimes the most powerful country on earth. I think that we can have global impact.
How do folks see this? All the readings were very kind of broad scale, thinking about public health and healthcare. Were folks able to kind of make that connection and thinking about how these power structures and systems connect to measurable health outcomes and the disparities we see? I see nods. Okay, that's good. And if this is interesting to you, I highly recommend looking up the World Health Organization and the work that they've done on tobacco control policies. On a global level, that's a really great example of how this progressive globalization can be implemented in a way that actually changes public health policies across the world, really. So if that's something that like you're interested in delving into, tobacco control policies is a really great area to do a deep dive into. I'm curious to hear from those of you who are physicians or working in a healthcare setting, thinking about power within some established structure. What are like some takeaways for you in terms of the practice that you do?
I think it's interesting because physicians classically are seen as powerful people. Off in medical school, you're taught, well, you're kind of the apex of the medical hierarchy, and people look to you for leadership. But when it comes to real practice, we find ourselves dealing with corporate issues. And the people who really have power and who direct what happens are insurance companies, CEOs, and often you have to kind of fall in line with what they're saying. I don't know if everybody knows Carlo Govia in HPA, but he loves to say, it's all about the money, and like that's really what it comes down to. It's less about the people and more about the money. So I think like there's kind of an inversion of the traditional power structure.
Patrick, could you expand a little bit more on how corporate has found its way in your day-to-day practice? I'm super curious. I work at UI Health. I'm not a physician or a clinician. I've never had to encounter corporate in any of my work at UI Health, so I'm super curious.
So, I mean, my current work, I work for the county. I work at the county jail. There's nothing corporate about it. It's all, public health based in that sense and government funded. But when I was a resident at my residency clinic, with private insurance patients, that's really where you see the corporate aspect of it, right? Because everything from the US model of employment-based healthcare coverage that then leads into corporations. Blue Cross is the biggest one in Illinois, United Health, all that. They set the plans that employers buy into, right? And they make the decisions about what they're going to cover and how they're going to cover it and how it's going to go. And so that's what it comes down to. I mean, look at UI Health, right? You serve a large, traditionally medically underserved population. It's technically the state hospital system. And how long does it take for a patient to get an MRI at UI Health, right? Go across the street to Rush that primarily services people with private insurance, and you can get an MRI same day.
You're absolutely right.
And that's corporations working inside medicine.
Ironically enough, my mother actually works for, y'all don't know what it is here, but on the East Coast, it's like one of the largest unions for healthcare workers. So it's 1199 SEIU. And she works customer service for them. So she gets the same insurance that like doctors, nurses, healthcare workers get. And we did until, I turned 26. And you're right, the service that I was able to get once, because there was a time we didn't have any insurance. So I had to pay for so many things out of pocket. It was like hundreds of dollars. And then when we got that insurance, it's like, it's like the golden ticket of insurance. But then moving here, now I'm on campus care. and I have to get testing for certain things. And I was supposed to have a doctor's appointment in December, but nobody showed up. I called, they took my copay, but again, no one showed up. I was on the phone, I was waiting for an hour, and then I called. I have had like months of back and forth to get blood work done. They're like, oh, well, you technically have to do a telehealth appointment before you can come in to get blood work done. And then they were like, oh yeah, the doctor will determine if blood tests are medically necessary. And I'm like, well, for autoimmune disorders, don't you have to do blood tests? You can't just look at me and guess. So I have it for like next week, and then I don't even know when I'm getting the blood work stuff done and any other things I need to be in person for. They still want me to go through telehealth. Like I have to get MMR boosters. They still want me to go through telehealth. No one's coming to my house to give me a shot in the arm. We know I haven't had my MMR stuff since I was a little kid. Why can't I just go in? So that's happened. And then with COVID, that's also been an impact. A friend of mine, and I'm not going to get too deep into it, but a friend of mine, he was having some issues, but because they weren't COVID issues, his appointment was pushed back 2 months. When he finally was able to go to the doctor, they found out he had pancreatic cancer. And then his treatment stuff was pushed back another 2 months. And by the time he was going to get the treatments he needed, it was too late. So he passed. And it was just so upsetting all the time that was lost, because his issues were not determined to be as medically necessary or whatever, because of COVID. And I have another friend who's a nurse, and because she's a nurse, she was able to get things she needed at that hospital, and she found out that she had uterine cancer. And so now she's going to get the healthcare she needs pretty immediately because she's going to the hospital she works at as a nurse. And she works as an ICU nurse. So I guess there's also that kind of argument with the nursing too. But like, it just, like, of course I'm happy my friend is going to get the help she needs, but I think about the delays that my other friends have had, or, you know, the way the system is, you know, how it's set up and how it's contributing to this real detriment to people's health and the effects of that. So sorry for that little. Yeah.
I mean, I think that's interesting because you kind of bring up points regarding capital, right? And your friend who's a nurse has that capital. She's hooked into the system. She can find ways. And your other friend who unfortunately has pancreatic cancer, like, is not, and doesn't have the ins, wasn't able to pull the strings when there was this, I mean, the pandemic, it sucks, right? Because people got delays in care, but it's like a balancing act between, like, you know, individual rights and community good on like the largest scale. And of course, it's never going to be exactly right, you know. But I mean, I really think with the nurse, it brings in the capital. I mean, even for me, my husband was able to get a COVID shot today. He's in 1B. And I was able to pull that off because I know all the places to look. I know all the websites to go on. And I can direct him, like, go here, go there. And there's so many people, there's millions of people in Illinois who are eligible right now and can't get it because they don't know what website to go on at exactly right time. So there's lots to be said.
Related, I'm a primary care doctor at UIC, and who has campus care. I'm so sorry. You can come see me and I can try and fix things. But related, like when UIC started in, opening up the COVID vaccine for anyone who's currently eligible in 1B, it was like definitely an interesting rollout. They had reached out to the doctors, the primary care doctors ahead of time, just saying that we're going to send it out via MyChart, anyone who's eligible first, which then cuts out like all of our patients who don't have phones with internet access, the app, et cetera. Like, it's just like, and then they basically just put it back on primary care doctors. They're like, if you know of any of your patients who are eligible and don't have MyChart, call them to schedule them yourselves. So that is, I guess, like another, I don't know, thinking about how like capital and privilege and things play into these things. That was a huge bummer.
I mean, okay, so I have campus care, y'all. And I have been in a position where I've not had insurance at all, or I have had, I don't know if you guys even have heard of it, county care. And I'm sorry, like campus care is like levels up from county care. So you talking about not being able to be seen or get what you need, or experiencing going to doctor's offices and they realize you have county care, and then somebody saying, oh, well, we're not taking new patients now. Like after they already booked my appointment, because they just don't want to deal with that insurance or the patients who have that insurance. So to me, campus care is kind of like gold, but I've never had anything better than that. So I don't have anything to compare it to.
Mm-hmm. Yeah, I've had in New York the equivalent of that too. And it's, ooh, it's the worst. It's like, good luck, emergency. It's pretty much emergency room care. Like I remember when I had the equivalent of that, I was in the emergency room, I think from like 12 to 5 a.m. hoping that something opened up and I could get somebody to tell me something. I thought I was having a heart attack, by the way. And it was just like, we don't care. The only time someone actually like people actually took it seriously, this one woman literally passed out from pain. She's like, I'm in a lot of pain. They're like, it's just because you're fat. Like she was sitting down in a wheelchair. She's like, her daughter brought her in a wheelchair. She's like, no, I'm in a lot of pain. I don't know what's going on. You know, she's worried she had blood clots. They're like, ma'am, just sit down. Did you take some, I think they asked if she took ibuprofen or something. They may have thought she was drug seeking. I have no idea, but she was sitting in the chair and then she wasn't feeling well. And her daughter was like, can I get a wheelchair? She tried to help her mother into the chair. She fell, she blacked out. They could not, they tried to wake her up first. I was like, just get her to the back. But yeah, it was just, I was horrified. And it was still, I think, a few more hours waiting. I was sitting there like, I'm gonna die in this hospital. Like, and that's happened to people. Like they're just told, go home, you're fine. No, I'm not, something's wrong inside my body. Someone needs to see me.
Yeah.
That actually, I'm sorry.
Oh, go ahead.
That actually happened to a classmate of mine in high school. She was at an emergency room for over 6 hours. It turned out she had a ovarian cyst that went septic, and she died waiting for care in the ER.
Yeah, as we talk about all these stories, like they're singular incidents, but there's a pattern, and we know there's a pattern, there's a system that allows for that pattern to continue. So like with all these different examples, we see the different levels where there's some power that some person has that's not being used, right? So like even at the ED level, there's someone who's in charge of what the emergency department policies are. And then there's the hospital system and like the way that they do their medical record system, and then these insurance policies. So there's like so many levels of it. And so when we're talking about organizing, both within these systems, but also outside of these systems, it really emphasizes that importance of power with, because there are so many different levels to it. You can't just, pick one and hope that fixes the problem. I know we were talking a little bit about the corporations, and one of our readings was about this anti-corporate movement, and just the role that corporations play on health, both like distally, but also physically, if we're talking about something like pollution and manufacturing corporations. So I want to ask on the discussion board, how do we engage and involve them in our efforts to improve public health? Does anyone have thoughts or ideas related to that?
You mean involve the anti-corporate movement, right? Not the corporations.
Right.
Okay.
Yeah. How do we respond to corporations? And do we, I don't think there's a right, wrong answer, but if we do include them in efforts to improve public health, what does that look like?
I think what Ben said, you'd have to think about self-interest. Like, what are their self-interests and how do they work with the group self-interest, and how do you sell that?
I think it's really hard because a lot of corporations that are viewed as so negative and evil, and they definitely do negative things, have their hands in many buckets in many industries. And so like you could boycott, I'm just thinking off the top of my head, like Coca-Cola, like the soda, right? And say, nobody buys soda, we're gonna take Coke down, but Coke owns like a zillion other products. And so like, it's almost impossible to attack these corporations because they're in so many aspects of our lives. And we, I saw a meme once, on the US coin says like, in God we trust, but really Americans, the way they act is really in corporations we trust. And that's kind of says a lot.
I think I would wonder, and I'm quite honestly, I'm not sure if I'm supposed to be here. I'm one of the prospective doctoral students. I'm the chief of an EMS academy, and this is the first one I've been able to join. So if I'm supposed to be gone by now, please tell me and I will happily excuse myself. But I think one of the questions is, in picking battles, obviously there'll be issue by issue, but is it always better to try to, is it a better fight for whatever victory you're looking for at a given moment to try to do away or work around or without corporations, or inform them and influence them so they do better things? Because they're, given that the kind of the federated nature of so many American things and the power that corporations have, where would we be in some cases if they just close up shop and move elsewhere? If the local Walmart for any reason closes down and moves away, that's a dramatic impact on all kinds of things in that area, including public health. So, how do you pick the battles and what do you do? And of course, there are some good ones. I think about what you have. I'm from Washington, D.C. That's where I am, where every corporate association's national headquarters is, and they all manifest themselves all summer to pay call to Congress. They seem to be very receptive in some of those levels to listening to people about issues and trying to engage in communities. I know that here, places like Kaiser and some of the major medical corporations out there do a tremendous amount to engage in local communities. I think that sometimes might be easier to do than get them to change and recognize the evil of their ways because you or I say so.
Yeah, it's a great point.
Sorry. Yeah, I was gonna think, and I'm thinking that too, that I think we also have these conversations about corporations as if they're all the same, right? So we can be like, when Patrick was talking about Coca-Cola versus like Burt's Bees or what's that company that makes that Castile soap everybody loves?
Dr.
Bronner's. Thank you. Yeah, so there are levels to the corporations that we can work with, like short-term, long-term, right? And there's like different types of corporations. So I'm thinking like, for instance, Burt's Bees, and they are stressed on like honey and bees and their campaigns to make sure we have bees, right? And Bronner's and their equitable pay, and other companies that do equitable pay amongst their employees, right? Those are the kind of corporations we would like other corporations to emulate. So if we're doing that, right, we would work with corporations that have less bad corporations that have good policies to leverage that power that we can have together to leverage corporations that have less good policies. And also always remind corporations that some people see, and I'm going to get a little technical, political, economical here. Some people do see other markets as more viable than the US based on the population of the people in those countries. But in terms of buying power, the cultural and other types of differences will not make it viable if a corporation based here was to up and leave. And so some will leave and have their labor be produced in another country, but to leave and have their products leave the country entirely would be disastrous, because like other countries are doing free trade agreements with one another and not the US, but also because we have such a strong buying power dynamic in the US. even if we only have like 300 million people versus countries that have twice as much or 3 times as much, they're not going to have the same buying power or buying power leverage as the US. So I think we can also talk about that. So a combination of working with better corporations and then also saying, oh, if you leave, you're going to take all of your, okay, that's great. I'll drink Poland Spring or something like that, or Deer Park Air or whatever, which I think a lot of those are like also multinational corporations, but them leveraging saying we're going to leave and saying we're going to go to this market, they have tested other markets. Like many corporations have tested other markets, and there's a reason that they're still primarily in this market. So I think that's also something to say. Is it? I'm sorry, someone had put about Burt's Bees, but yeah, I just wanted to say that those are other techniques we can do using corporations that do have better policies and working with them to leverage that collective power against organizations that don't have the best policies.
Mm-hmm. Yeah, and so many of the corporation policies, Ben kind of alluded to this, but they are tied up in politics and funding of campaigns. So in our reading a couple weeks ago, there was mention of policies for more transparency and accountability in campaigns, and campaigns that don't cost like millions of dollars for someone to run, right? And so a lot of these times our system is kind of built on this created necessity for millions of dollars of funding in order to run for public office. And so that really gives opportunity for big corporations to kind of put their interests at the top of the politicians' list, right? So especially when we collectively do not have, well, I don't know about you, but me and my family do not have $1 million. And so thinking about like what it looks like to go up against these corporations who are financing politicians, that's really, really important to think about how all these things kind of start with just the way that our political system is built, and then it has this trickle down effect. So public advocacy of policymakers is so important.
You know, one way to balance that, and I'm a very unusual first responder. I moved to this city to work in the belly of the beast, cut my teeth on Capitol Hill here. One of the things that I think can go unappreciated by everyday citizens is the impact of old-fashioned letter writing and email campaigns to your members of Congress. It is the antidote and the parallel to the corporations and trade associations who come en masse going from door to door like little honeybees for weeks at a time. It is the antidote. I guarantee you, if in any given political district at any level, large numbers of constituents write saying the same thing, they absolutely are going to pay attention to it. I mean, I can remember just a number of issues at that time that came across, and it was the only thing we were paying attention to. So, I mean, that's not to be unappreciated. If everybody in a city or a town says, you know, purple is bad, the member of Congress is not going to wear a purple tie, you know, because they want to keep their jobs, and the one thing they have to do is listen to their people.
Yeah, it's a great point. I think especially in public health and healthcare, the outcomes we look at are very like tangible and looking at health disparities, but the problem is all the way on that upstream that we're talking about. Yeah, and I just put in the chat, we have our action lab on advocacy to policymakers in a couple weeks. So we will talk about how to do that. Any other thoughts folks would like to share with the last couple of minutes we have here?
I was actually thinking about that as well. During the presentation, he had shown that kind of like the upstream downstream model, and I was wondering how you like apply that to this kind of having influence over corporations, because there's a lot of larger scale issues, right? Like I noticed in the chat that Shannon had mentioned that Burt's Bees that we were discussing is owned by Procter and Gamble. So it's kind of like a similar analogy there as well, right? Like you have to address those downstream factors about like the various effectively goods, I guess, that Burt's Bees may be doing for the environment, but it's still stemming from a great deal of potential harm and control that and effect biopower pretty much that P&G is exerting on people.
Yeah, I think that's a great question. I know this isn't a satisfying answer, but I think it goes back to the broader economic policies that we have as the norm that allow that to happen and make it hard for smaller companies, make it easy for large companies to acquire smaller companies, right? And also creating, there's not really an incentive system in place to give a reason for that not to happen besides, I guess, principle, if the person who has their company up for sale wants to, do that. So like thinking about, power is money and just the way our society is structured to be capitalist. And the readings kind of talked about this a little bit, but the incentive for corporations to keep doing what they do is to make more money to appease the shareholders, right? So it kind of goes back to the construction of the system in which all these things operate. And really the only way to deal with that is like rewriting it, right? So going back to like broader economic policies and thinking about protections for smaller businesses, for instance, and how that can have a larger implication on something like public health, which we don't really necessarily connect those two together a lot of the time. Travis asks, can we include responses to the reflection exercises during the lecture? Yes, I would love to read those. Yeah, and so when we're thinking about that upstream, downstream illustration, I like to think about like all the different points of intervention. The slides are posted on Blackboard, but one of the examples on there was like a more downstream factor. If we're talking about teenage pregnancy, for instance, a more downstream factor might be access to contraception, that like it should be available in schools. So that's like a potential more downstream policy. But if we think about further upstream, talking about like why the quality of sex ed in the first place in our country and the fact that there's no federal, requirement. And so there are a lot of different like points along that stream that organizing can be done. And there isn't necessarily like right and wrong of like, you shouldn't give attention to making sure school has free condoms, because that's important too, and that does make an impact, but also thinking about the system that allows that to be okay and be acceptable, and all the implications of that. So I really liked how Ben answered one of those questions of like, where do you see yourself kind of philosophically, but then also like, what are the spaces that you're in? What are the rooms that you're in? So, if you're a physician, someone said this, like you do have this like power kind of like ascribed to you just because of the title that you have. So how can you use that? And thinking about, even if you're not powerful enough to change the insurance policies of your company, what can you do as an individual? And who can you advocate to who is above you that does have that power over? Because at least I would hope to think they listen to the doctors more than the patients, at least.
Can I add one little optimistic campus care thing on that note?
Yes, please.
All of the people, the family medicine doctors who provide the primary care for campus care were super frustrated that campus care didn't cover LARCs. We had to do this really silly workaround for anyone who wanted an IUD or like a Nexplanon, or we'd have to send them over for Title X funding over at Mile Square. And it was like a really silly workaround and it made no sense. So enough of the doctors all complained that they cover LARCs now. So that is something that has changed in the past year because of physicians, using their voices within the campus care system.
Yeah. Also, if you're part of the union, was it GEO? I'm gonna say GEO.
Yeah,
we also
GEO.
had a lot of different things that we did as well in terms of like what campus care will and won't cover. We also do bargaining with that too. So, you know, if you're part of the union, if you can be part, because I know some people can't officially be represented by the union in certain ways. It's weird. I don't understand it because for me, a union for students should be all students, but there's a whole thing with RAs versus GAs and TAs. There's that difference. I know the law has changed where all grad students can join a union. So I don't know what they're doing with that, but that was something else. And we were, after we were striking, and then when the pandemic hit, we were like, we need to make sure things are covered in terms of COVID stuff. And we, you know, did that. Thank you, Alexis, for putting the grad students union. Yeah, so there's a lot of stuff that they're also doing to help change different systems, making sure, you know, pay is equitable in case you do have to get something outside of the system. So yeah, collective power is definitely, and I've been a part of a lot of letter writing campaigns. When Julius mentioned, I was like, oh, there's a lot of groups I'm part of. We actually have postcards, we fill out letters, and we physically go when we can to the Capitol. We meet with people, they see our faces. So that's another thing too, when we can do that again.
Yes, I highly encourage, I guess this is political, but who cares? Get involved with your union. If you're eligible for a union, highly encourage it, because those bargaining units do make a big difference, as we have kind of seen with the CTU situation that is ongoing. So with that, folks are free to go. I'll hang on for a few minutes for folks that want to keep chatting. Feel free to email us if you have questions. Thanks for the great discussion, everyone.
Alexis,
Thank you.
This has been quite amazing to finally catch one of these sessions. I'm curious if you don't mind telling me kind of how you decided to, the thing for me is how to decide to pull the trigger on this. I'm an unusual person. I actually am the program director for the EMT Academy for the DC school system. So I have a foot in the medical world and the foot in the world of academia and teachers, and I'm a member of the teachers union, as it happens. But I mean, it's the hardest thing in the world for me is to decide how and when to apply and jump into a program like this, because I'm sure, like many faculty members and administrators, there's always, a pile of stuff on my desk, but I'm trying to motivate myself to come on with it, quite honestly.
Yeah, I don't know if I can I don't know if this is helpful or encouraging, but I think at least for me, doing the PhD has been kind of like a suck it up and do it kind of experience of looking at the benefits. I think one of the biggest things for me was looking at the benefits and the reason for getting the PhD in the first place and what comes with that.
Oh, sure, that's useful. It's very odd because I'm the only clinician in the entire faculty, I think, of the entire school system. I'm in a whole new position now that we're in a global pandemic. Before I think I was this eccentric old man that nobody really understood whatever I was talking about. And now everybody and their brother is trying to email me, call me, and get me to say things because all they get is from, everyday school sources. And I'm plugged deeply into the health world. So that's very helpful just to suck it up and do it. I like that. So besides, I'm a military man and that's language I can respond to very well.
Oh, good.
Cool.
Yeah.
Cool.
So hopefully that helps. And I would say, I guess a plug for UIC is that there's a lot of variety of ideas. And there's a lot of spaces to explore those ideas like this course. So it's really a great environment for talking about the system we want to kind of uproot and dismantle.
That's cool. That's very helpful. I have a dear friend who is a graduate of this program, so she is definitely doing her part to put in a plug for the alma mater. She is always encouraging me to come on and jump on out to UIC. It's the only one I've been looking in deeply at because I know someone who went there. I don't know anything about anybody else's program. And I like that it was already sort of virtual before virtual was cool in some ways. So that I can do it without having to uproot my life is huge. And that's a big one because I can't leave the city. I have stuff going on all the time. I can't, one of the first challenges I realized is that if I'm going to do this at all, I have to find one that doesn't mean I have to stop teaching, because it's the only way I have to pay these tuition bills that I'm sure they're going to send me. So that's cool. That's helpful. Very helpful. Well,
great.
Thank you. I hope I'm able to catch some more of these. And I think I am going to get myself together and see if I can apply to begin in the fall.
Great. Well, best of luck.
Thank you.
Nice
Have
to
a
meet
good
you.
evening.
Kelsey, are you going to hop